Kia ora koutou. I'm Caroline Armstrong. I'm a GP at Mana Medical Centre and I have an interest in menopause and women's health. Here at Mana there's myself and another colleague, Rini Chegudi. We both see patients who are getting symptoms with perimenopause and menopause, both for our own patients but also for casual patients who are registered elsewhere. And we decided to offer that service because we recognise that there's a need for managing symptoms that women are experiencing. It's an area we're both passionate about and it allows us to have a bit more time to be able to talk through the symptoms that are bothering women, helping to find a management plan that works for them. So it's very much tailored to the individual, so we want to work out what's bothering them the most because it's very different from one woman to another. It's making sure that we're addressing their concerns, getting them feeling like them again. Start by asking what their menopause journey has been like to date and just listen to the symptoms that they want to bring up. I will ask specifically about common symptoms such as hot flushes, brain fog, irritability, mood changes, genitourinary symptoms, so looking at bladder function, pain during intercourse, that sort of thing. I find the AMS symptom score sheet really helpful. Although I will have a conversation about those symptoms, I'll also ask them to quickly score through between 0 and 3 how much those symptoms are bothering them. It's a nice visual thing for women to say, actually, yes, these symptoms have gone down from a 3 down to a 2 or down to a 0. I find that really helpful. Also, I think the whakama kind of behind it and not actually wanting to talk about some of these symptoms. A lot of women are quite happy to say, oh yeah, they feel as though they're really ragey and irritable and they get hot flushes, but they're much less likely to volunteer themselves, actually, sex is painful, I leak when I cough and sneeze. Those are questions that I routinely ask my women, even outside of menopause consults, because if we don't ask those questions, we don't know the answers. And often those simple questions just in a completely unrelated consultation can open the door to conversations around menopause symptoms. In general practice, we are the perfect area to be able to offer this service because we have that longitudinal care. I've been at the practice here for over 10 years now, so I've known my patients for a long time, which is really lovely. But also just seeing the change in where they are in terms of time of life. We don't have to get everything done in one consult. That's why we have our longer consults for the menopause clinic, to allow us the time to explore all of these symptoms, because it can't be done in 15 minutes. It's a case of we try one thing, if that's not working, we alter doses, we work out what works best for them, and it does need to be done over a longer period of time. So as GPs, we're well versed in looking after people for long periods of time, and it's a core skill that I think a lot of us have and enjoy doing. I'm a mum, and certainly I think as a mum, our own health needs we tend to put below the rest of our family. Women often do put aside their own needs. Women's Health Week hopefully will help to say, actually, women's health needs are important. We do need to look after ourselves. If our cups are empty, we can't expect to fill other people's cups. So it's really important to look after ourselves as well as our wider whānau. One of the reasons I really enjoy doing menopause consults is that you do notice a big difference between one visit and the next in terms of their quality of life and feeling like them. A lot of women will say to me that they just don't feel like themselves anymore, and I find it really rewarding from a clinician point of view, being able to see them regain themselves again. It's really nice being able to walk alongside them in their journey to try and help with that improvement.